Hi, I'm Claudine Diaguirre from M2A section. So today is I will be performing a post-mortem care for my deceased patient. So first is I will check for my patient's death certificate coming from the doctor to verify. Okay, after that, I will now ask for the permission and to explain toward my patient's relatives that I'm going to perform a post-mortem care for my patient to relieve their anxiety and ask for their cooperation. Assume that I did that. I will now ask my significant others if they wish to remain here inside the room while doing the proper procedure that will be done. And then after that, I will now prepare for the necessary equipments to conserve time and energy. And then I will now close the curtains to provide the privacy as well as the door. And then I will now perform a hand hygiene as well as a proper gloving to prevent the spread of microorganisms. And then, after that, I will now remove my patient's jewelry on her skin and to the other side. Okay, and give it to the significant other. And then after that, I will ensure that any unnecessary clothing, the equipment, as well as the tubes or supplies are removed according to the facility policy. And then, after that, I will now close my patient's eye and as well as the mouth for privacy. Okay, after that, I will now perform a bed bath on my patient to prevent any discoloration. Okay, assume that there is a water inside here. Then I will now performing the bed bath on her head, cheek, chin, as well as the neck, and as well as the ears. And then as well on her upper extremity and lower extremity as well. Only exposing the areas that needed to be cleaned. And then on her lower extremity as well. While still giving her a privacy. And then, assume that I also did the other side as well, and as well as her abdomen and the chest and the perineal area if necessary. Okay, after that, I will now put on the cotton for my patient on the eyes, on the nose, as well as the ears to secure that there is no any drainage of the secretion that will be out. Okay, after I did that, I will also secure my patient's jaw with the cravat to prevent from stiffening and as well as opening. And then after that, I will give my patient's relative to view or not to view the patient and accompany them for compassionate care if they wish to. And then after that, I will now as well apply a name tag on my patient's foot for identification. And then after that, I will now cover my patient with the shroud and secure it safely with the pins. So I will now remove the blanket first to provide her a privacy while putting on the shroud. And make sure to dispose it on the soiled linens, on the proper disposal. and then secure it with the safety pin. So assume that I have secured it already with the safety pins. And then after that, I will secure another name tag on the shroud as well. Okay. After that, I will now remove my gloves and perform a hand hygiene. And then I will now transfer my patient on the morgue for embalming as well as for autopsy. And then I will now document the procedure after. Thank you.